hear so much about the broken traditional chronic care models. But today, I want to share with you somebody who is creating a different model, one that works because it is a collaborative care team model. It includes board certified doctors, it includes dietitians, it includes psychiatrists as necessary, and it includes health coaches. I got to know Dr. Innocent Clement a number of years ago when Ciba Health was just getting started, and he has been very committed to health coaches from the get-go. This is a wonderful practice that I think needs to be the standard of care for chronic disease management. So he is getting wonderful successes. Diseases are being reversed. Need for medication is declining. And this is a practice that is available because it's affordable. And I believe it needs to be the future of medicine. So let me tell you about Dr. Innocent Clement. He is a physician, an entrepreneur, and the founder and CEO of Ciba Health. He brings together clinical training, public health, and business experience to build scalable, outcomes-driven care models. He has spent the past 5 years leading Ciba Health's growth into a precision care platform that serves employers, payers, and health systems. I know that you are going to be inspired by my conversation with Dr. Innocent. And if you are a health coach listening, take note. He is strongly in favor of healthcare through health coaches and a big, big supporter of FMCA. And we are grateful for collaborating with him. So I'd like to introduce you to our community, Dr. Innocent. You have been doing some wonderful, wonderful things. And so I'm excited to talk to you today.
Yeah, thank you so much, Sandra, for, again, your time and really to connect with me this morning. And then I'm happy to always, connect with the community and share learnings, insights, and how we are also changing the paradigm from how patients with high acuity polychronic condition are being helped manage today, the frustration, and how Ciba is changing the narratives around, access, better outcome, better
Yes.
engagement. And so I'm excited to have the conversation.
Tell us about this notion of precision care. What would that actually look like in practice, and how would it differ from the traditional care model?
It's an excellent question, Sandra. I mean, one of the reasons why I started Ciba in 2020 was also as a result of my own frustration with, managing patients with high acuity polychronic condition today. They are frustrated with how care is delivered, how they access care. And that led me to begin to think about a new model that it's really completely innovating and changing how we deliver care. And so we call it precision care model. So precision care for us is really leveraging data about this individual. The data would include your labs. Obviously, the labs that we test at Ciba is well above and beyond what's been done at the traditional settings today. Our labs allow us, based on our protocol, to really do a deeper dive into the root causes of this condition. And so once we leverage the biomarker testing, that we put together as a custom panel to do a deeper dive into this individual, we have a better understanding on the root causes of the condition. We have a better understanding how to support the individual really to optimize their health. Two, to really ensure that we're delivering a truly personalized whole person care model for every patient. Hence why it's called precision care model. And precision care model leverages not just the data alone, it looks at how do we leverage technology, the cutting edge technology today that create efficiency and allow us to automate a lot of the work that we do, but also the multidisciplinary care team. So the multidisciplinary care team include a doctor, which is board certified, include a dietitian, include a health coach, and as well as behavioral therapists. Also, they include what we call psychiatrists as needed. But so you build a model that is centered around the patient that leverages the multidisciplinary care team, the technology, the data to deliver a whole person personalized care model. So this is what we define as precision care. The goal is to get to the root causes, leverage this biomarker testing, and hopefully reverse or put the condition into remission.
This is just such a cutting edge model. And I've followed you since you started Ciba Health.
Yeah.
It is when we talk about the dream team, a multidisciplinary team, because that is the way care can be personalized. And we've lost that so much. So what are some of the things that, because even from the time Ciba started, it's gotten worse in a traditional model. What are some of the things that you are seeing in terms of the just some of the issues going on with the traditional healthcare model?
I mean, this is a lot of frustration, right? Even providers are frustrated, consistently. I mean, they're like, this is not how care should be delivered. But unfortunately, you're in a setting where you can't make any, in leadership, you can't make some of those decisions to change what need to be changed. And so the system is broken. We all know that. And even though I hate to use that word broken, but it's 100% is broken. And, the care today that is delivered is so siloed. A patient with maybe autoimmune GI issues would have to connect with multiple providers, right? I mean, and the challenge is those providers also don't share that data real time. That data is always, either the patient would have to book an appointment with maybe a dietitian, book an appointment with a health coach separately, because the traditional model did not have all that as part of the care model. So if a patient needs to see a dietitian, then obviously either the provider will give them a list and say, hey, here's a list, go book an appointment with this dietitian. They can help you with the diet plan. You need a health coach that will help you behavioral changes, that can handhold you and support you. You need to find one, right? It's not part of the care model. And the patients are frustrated. So you're managing multiple providers and data is so siloed. Each of those providers that you're visiting don't have a way to share that data real time. And, that also led to, if you look at Ciba today, from 2020, the number of clients have increased significantly to about 107. It's a small company where we are today. It shows the adoption of this new care model, a model that has proven to deliver better outcome, better engagement, and deliver this truly, truly personalized model where providers are working collaboratively. The doctor, the dietitian, the health coaches, the behavioral therapists, the psychiatrists, the specialists are all sharing data on one platform on how they can better manage and optimize the patient's health. So once you're able to establish that, that helps you to really continue to impact, the current gaps that we see in the current care model today.
It's such a good model. And I know that just anecdotally, as well as there's been some research showing that for the doctors, it eliminates burnout because doctors are so burdened today. And they have found when you add a health coach, for example, when you have a multidisciplinary care team, it is wonderful for the doctors and certainly for the patients because they're, as we've said, they're getting that personalized care. It kind of reminds me, so many, many years ago, we're talking like early 70s, I was a special education teacher, and that's what we did. We had a multidisciplinary team. We'd have an extensive evaluation, let's say, for learning disabilities. And then there was a social worker and a physical therapist and occupational therapist and teachers. And they really got the care that they needed because of that multidisciplinary team. And we'd have staffings where each person would share their perspective. And so this is just such a good model. What is your plan for, or I should say, in terms of what are some of the things you have noted so far in terms of patient success stories?
Oh, I mean, it's if you look at, for us, we believe in, our solution. It has to be evidence-based. It has to whatever we say, we must have data that supports and back that, right? So we collect extensive data from, user experience, net promoter score, patient symptoms, how they measure the symptoms using the validated questionnaire. But the most important thing in the shift today, we've seen how AI is also really, really completely changing how we deliver care, how members access care. It also really create efficiency for the care team, which means providers now don't have to do a lot of some of this admin work that they do, like the notes taking and summarization of patient visit. And also really create what we call the risk stratification model. So as a member comes in, during the intake process, they go through a very comprehensive questionnaire. That questionnaire allows us to create a risk stratification and a care pathway and assign a dedicated care team for each member. And this dedicated care team, what the technology does for them really helps them to be efficient. It allows them to really focus on delivering care, allow the admin work, note taking, analyzing that data is really taken over by the technology where it aggregates all that data, summarize that data, create a structure for you, highlight and flag areas where you need to focus on, so that you can look at that. And based on that information, you now be able to support the patient as needed. The other element there is what it does for them is also, when you talk about personalization, we collect three main data buckets today. One of the data buckets we collect is data from the lab testing, data from the questionnaire, data from connected devices, the wearables that we send to the patients, right? Which include Fitbit, Oura Ring, scale, blood pressure monitoring curve, and all that, so that we can collect comprehensive biometric data and layer that data with the biomarker testing that we do, existing lab that the patient would have, and as well as really looking at a comprehensive questionnaire, so that you create this sort of comprehensive model that is geared towards empowering the patient, one, two, delivering better outcome, three, allowing the care team to be proactive rather than reactive. Right? Today, a lot of the care model is reactionary, but what we're building today is to really leverage technology and create a model that is proactive, a model that empowers patient, a model that creates efficiency for our care team so that they can focus on what they know how to do best, a model that create, data efficiency, structure for all that is involved in managing this patient, and ability to share that data with providers outside of our own network or outside of our platform. So when you do that, you create a model now that has shown that this is what healthcare should be today. And because of all this that we've done in the past, I would say this will be our sixth year, we've seen incredible patient outcome, from reversing their condition, from really eliminating medications, and from patients who are been told in the past that you will live with this condition for the rest of your life. And then seeing that that condition can be reversed, that has changed the way patients look at healthcare. And obviously, Ciba cannot do it all alone, right? So we need to begin to see other other vendors adopting this model so that we can support, our patient population. You saw what's going on with the current healthcare at a policy level. There's a huge change now happening at CMMI, which is Center for Medicaid Innovation, or CMS, as well as the HHS. There's a lot happening today. They are all thinking about whole person care model that leverages multidisciplinary care team to deliver care.
It is such a comprehensive, state-of-the-art model. How do you successfully integrate health coaches into this care model?
Health coaches plays a huge important role in all we do and how we deliver care, because they serve like the quarterback, right? So they are the first line of contact for every patient. They have access to a dashboard where they identify patients who are at risk of disengaging or are struggling. So they really reach out to this patient, handhold this patient, and this health coaches really help to provide that care coordination and work with the patient, the doctor, the dietitian, with everybody who is involved in delivering care. So they play a huge role in how we deliver care, how we support our patients, and how we, stratify the patient, move them into specific really buckets. So for us, we call it the high touch, the moderate touch, the low touch. And at each level, the health coach plays a huge role there in supporting the patient, but also supporting the care team because they are all involved. They share data in real time. They understand the patient more because they have interaction with them a lot more. And so they're involved every step of the way. When you're setting up the devices for each patient, because we send a toolkit to the patient, which include, I talked about earlier on, the scale that measures, smart scale that measures blood, that measure the weight, BMI, blood pressure monitoring cuff that collect blood pressure data. We send them Fitbit, we send them also CGM. So the health coaches would help them, one, establish a goal. What are they looking to achieve today? What's been difficult for them in the past? How can we work with them collaboratively to support them to be part of this care model and establish goals earlier on with the patient, what they can do, what they cannot do, what sort of food can they eat, what sort of food that they cannot eat, all that, right? So you collect a lot of behavior data, a lot of information upfront, and that information gets feed into the data stream. And that allow our technology to take that data as well to personalize the patient journey. But every step of the way, the health coaches are a part of the Ciba model that supports the patient, that support the care team, that also really ensure that the data and all the care team are working in sync, really delivering care.
Well, I love this model, and that's how we originally connected when you first started. And it is just so wonderful to hear that coaches are an integral part of the care team. And when I was writing my latest book, Your Health Coach Will See You Now, it was a lot of research into the power of health coaching, and time again, like study after study. I just saw another one recently. It's self-efficacy, and so I think when people are able to have the sense that they're the CEOs of their health, they can take charge of their health, that
Yep.
it changes on a daily basis, those daily habits do matter, then they're on the road to reversing these conditions, as you've seen, and compliance. We did our own research a few years ago and showed that compliance went up when they had a health coach. So it's really encouraging to see your support of the
Absolutely.
coaches.
I mean, once you embed them correctly, to be honest, like you said, really, it drives better engagement. It builds trust, it builds relationship. It shows that there's someone that is listening. And it's so powerful for the patient. A lot of testimonials that we get from our patient today, they talk about, wow, the patient would say, I've never seen this sort of model. I've never had an opportunity where I have a provider listen to me and try to know me and try to understand how they can support me and try to hold my hands and telling me I am not just a number and I'm not here all by myself. We're here to support you, to hold your hands and walk you through this journey and build a solution that would empower you and you become a captain of your own health. And so, again, the importance of health coach, it's not just because, they're there, but really when you build trust and you build that relationship, it changes everything. And, patients feel heard and they feel like there's someone that they can reach out to. It completely changes the entire conversation.
Yeah, so true. Something we hear frequently if we're talking about functional integrative medicine practices is like I can't afford it. No, it's steep membership fees, for example, or so if somebody were to come to Ciba, can you talk about your model in terms of the affordability? Is it insurance based?
Yeah, I mean, 100%. And again, like you said, this sort of care model, the perception is it's so expensive. It's not affordable for the common person in the street. But for us is what's a care model if every other person cannot access it, right? Then the aim is defeated. So what we've done is to democratize access to this sort of model, make it cheaper, make it accessible for everybody today. Today, the care model Ciba has built today that include the doctors, visits, the dietitian, the health coaches, the technology, the lab testing that we do is $2,500 for the entire year. As compared to paying $15,000 for a visit. I mean, sometimes, right?
Yeah.
But also most importantly is the standardization and protocol that we've built, right? So every provider they follow a specific Ciba protocol that we build that also leverages technology and to make this sort of models accessible, cheaper, but not just cheaper, but really deliver better outcome, really. So when you deliver better outcome, the cost associated with skyrocketing, chronic conditions, high acuity, complex chronic condition that's going up. There's a solution that Ciba has built that has democratized access to that sort of care that everybody, irrespective of your background, where you are, is able to access this model. This model can be integrated into insurance company, right? I mean, we've mapped out, CPT codes around a model that is also covered by insurance. We work directly with employer that are self-funded, employer that has assumed the risk of providing insurance for their employees, who are seeing costs continually to go up, really, and they're struggling to manage it. And so Ciba is telling them we have a solution that one will reduce the cost, that will provide access at a fraction of the cost. Today, when you go to a practitioner outside of Ciba, you're looking to pay $15,000, $20,000, which includes your labs and all that. But with the Ciba, you're only paying a fraction of that, which is $2,500. So $2,500. Let's say, for instance, a patient with autoimmune disease today. Autoimmune, we know how difficult it is to manage autoimmune. Most of the patients with autoimmune disease, they are on biologics. Biologics can cost an average of $8,000 today. And with Ciba model, our goal is to do a deeper dive, identify why do you even have this autoimmune condition today? Where is it coming from? And you build a model, a care plan that will help you to put that condition into remission or reversal, which means you will not eliminate medication that you're currently on, and there's a cost savings there. So for us, we think $2,500 that gives you access to a multidisciplinary care team, the technology, labs, testing, the devices, all this comprehensive care. I think it's a good deal, and that's why we call it the democratic. We are democratizing access to a model that has proven to work, at a fraction of the cost.
It's such a great model. And certainly, if we talk about the cost of care, just medications alone. And so that is something that's really important to see that this is doable. And what can you share, perhaps any outcomes that may have surprised you since you first started? And what lessons can we take away from what you've built at Ciba Health?
Yeah, I would say it a little bit different. Not even really surprise me because I know that the model works really if you engage with, what is recommended by the care team. And our goal is not just our providers, just, providing recommendation or care plan. You walk with a patient alongside yourself. You make them feel that they're in charge, right? So because today, if you look at the care model today, patients are really, doctors make all the decisions for them and say, this is what you need to do and just go, right? Go and implement this and do this and it should be fine. But the patient feel like they're not, no one listen to them. So once you listen to them, you begin to see incredible outcomes. We've just actually finished analyzing a cohort data for about 2,453 members. Out of those 2,453 members, 90% symptom improvement. We've seen significant elimination with a medication around 85%, right? An NPS score of about 80%, which is a net promoter score, really, from a patient perspective. We've seen reduction with emergency room visits, healthcare utilization. So this data is currently being validated by a third party that would audit it and validate and providers with a certification. But in the interim, we've done our internal analysis and we've seen significant cost saving, close to around 70 million across 2,453 patients, some with autoimmune, some with GI issues, some with cardiometabolic obesity issues, elimination of GLP-1, 85%, elimination of some of these biologics that we've seen that are so expensive, around 85%. We've seen symptom improvement by 90% across 2,453 patients. This is significant, right? We continue to see patients losing 40 pounds of their body weight. I mean, that is sustained. It's not, you lose the weight and it comes right back. No, because we figure out why you're also gaining the weight, putting together that care plan that has allowed members within first 3 months. I mean, some members lose within 3 months of engaging with Ciba, they lose the weight and it's sustained over time and they eliminate medication, which is very exciting. So for us, we continue to lead with outcome data that supports all the claims we make today. It's not just about promises. It's actually delivering value and showing with data that this works and why we should adopt a solution like what model like Ciba has today that continue to show value and make impact in the lives of our citizens as well as members wherever they are in the world.
You have had such a tremendous impact and have been recognized and have won multiple awards for your work for this model. Just one clarification for our listeners. Is this telehealth primarily? Is this a model that you can be anywhere in the world and you don't have to go to a physical brick and mortar building?
Yeah, 100%. You see, when we talk about democratizing access, is certainly we want to ensure that we have a model that meets you where you are, right? So what we've done is build a 100% virtual model. There's no brick and mortar. And, what supports us to be able to deliver value here is the connected devices, the technology element that we build, the remote patient monitoring capabilities, our AI model that is able to customize how you communicate with patients, identify patients who are at risk, and create a personalized recommendation for them, creating risk stratification, a care plan. So you were able to balance the human and technology. And doing this is not an easy task at all, right? To take technology and human and balance that and deliver a care model that is delivering value today. So we believe we don't necessarily need to have a brick and mortar location, but we have partnership, extensive relationship with larger health system. If there's a need, we can refer in there. They can go in there. But because Ciba, the way we position ourselves as a virtual first, which is also a virtual specialist sort of care model. And if a patient need to go in, we'll be able to refer them and get them provider care coordination to ensure that we send them to a location that is within the in-network, as they may say. But yes, your question around anywhere in the world, no matter where you are, you're able to download the Ciba app and go through the process, and you would have access to a care model that's meant for you, a care model that looks like what healthcare should be today.
Well, I love this model. So what would be, let's say, your dream for the future of Ciba? And
Yeah, a dream for the future is everybody everywhere should be able to access this model. It should not be limited to those who only have, employers who are able to pay for it. Insurance should be able to adopt this model and let's continue to democratize access to this model that has proven to work. Obviously, the US healthcare system today, is very challenging. And navigating it on itself, it's a massive headache. Patients struggle with that. We want in a situation where this model will be adopted by all insurance companies across the world within the US. And if that is done, which means access, for patients, irrespective of where you come from, your background, your environment, your culture, your income shouldn't be a barrier. to access a model like this. So my dream is to see this model adopted by a lot of those large health insurance company, and that would really allow for access by those who probably wouldn't be able to pay for a solution like this or don't have employers to pay for this. Yeah.
Well, I'm right there with you. And any way that we can support you with our health coaches, it's been a wonderful collaboration. So, Dr. Innocent, where can people find you? Where can they get more information about Ciba Health?
Yeah, it's easy. It's cibahealth.com. Type that in Google. You can find Ciba. You can, social media handles that you can also find Ciba there. But really, it's straightforward and easy. Type Ciba Health. It's going to come up, and you click on the link. You can learn more. You can connect with our care team, our sales team, to learn more about the model that has proven to deliver value, better outcome, lower cost of care, higher engagement. And so, yeah, I mean, we're excited. We're here, we're listening, and we welcome the questions. So anyone who wants to learn more, please go to cibahealth.com. And there's also a number you can call and have a conversation with our customer support. And they're happy to walk you through the model. And yeah, thank you so much again for this.
Oh, thank you for being with us. Thank you for the wonderful work that you are doing to help millions of people create better health.
Yeah, no, thank you so much, because we can't do this all by ourselves, really. I think it's also important to highlight the important work you're doing, training those health coaches really to understand, how to deliver this sort of care model that has proven to work well. And access to them, certainly it's important, right? The talent is, obviously, we know how difficult it is now to access talent. But again, thanks to your academy for really continuing to build, train additional health coaches. I mean, and, as you know, we've expanded into Canada, where we're also continuing to identify health coaches that want to hire locally to support our members there. I think it's certainly very exciting, and I really want to say thank you all for all the work that you're doing. Without you all, I mean, there's also going to be a talent gap. And then how do we even support this model if we don't have folks like you doing what you're doing today? We'll continue to leverage the ecosystem, your network, as we continue to grow and scale this business, identify new our care team to support our clients as they come on board. So thank you for all that work. And I look forward to continue to work with you and your team collaboratively as we continue to change the face of healthcare.
Well, thank you so much for those kind remarks. And it's just been an honor to know you, to see the growth of Ciba, and to support you by training health coaches.
Yeah, thank you so much.
Collaborative model. Thank you.
Yeah, thank you. Always great to chat with you. Have a good one.